Hey, my name is Florian Birkmayer MD. I'm from Romanosis with my wife Kathy Skipper, and today I'd like to talk to you about the importance of the archetype of the wounded healer in psychedelic therapy, which is also going to be a discussion about the shadow side of psychedelic therapy. And let's just jump right in. I think that uh, one of the hallmarks of psychedelic assisted therapy that's been promoted, and I would say most practitioners or people you write about, so I guess you could say philosophers or writers of it, agree that if you're going to do psychedelic assisted therapy as a provider, as a therapist, as a psychiatrist, a healer of some sort, it's really a prerequisite that you experience the power of these psychedelic molecules, or I prefer the terms plant spirit teachers, yourself. And the idea is that you can only um, accompany your client, the person you're sitting for, as far as you've experienced it yourself. And that's already the first sign about um, why the wounded healer is important. Because it's not just about saying, oh, yeah, I've tried ketamine or I've tried this or that. It's also about allowing ourselves to be humbled by these experiences, to genuinely be open to these experiences, to receive their gifts. Because to me, if I had to describe in one word what psychedelic assisted therapy or plant spirit teachers do, is they hold up a mirror. They're like a truth serum. We see things revealed from the unconscious about ourselves. And that, I think, is really that willingness to examine, well, what has my unconscious brought up to me? What's been in my shadow that I have been unable or unwilling to see that I now need to commit to addressing? I think that's what people really mean when they say, oh, yeah, if you're a psychedelic practitioner, of course you have to try these molecules out yourself. It's not about, oh, yeah, it was interesting. I saw interesting experiences. It's really about, are you committed to your wounded healer's journey? And this work also reveals a profound shadow aspect. Now, let's first, or many shadow aspects, in fact, let's first define what the shadow is. People often think, oh, the shadow is my bad side or the side I don't like. The shadow is like more or less literally our shadow when we're standing in bright sunlight. It's the part of ourselves we can't see. The shadow side is the side of ourselves that we can't see. You could say that, or in many people's cases, their greatest power is actually hiding in their shadow. I think that's often the case with many clients or seekers who say, oh, I have to see this specialist or this expert or this guru. It's in a way they have that inner healer inside, but they're unconscious of it. It's in their shadow and they're projecting it out onto someone else. And this can actually play into the pre-existing power dynamics. There's a term that's being bandied about now called power tripping, where healers, practitioners are unconsciously seduced by this projection by the client, and it makes them power trip. Um, and again, especially if we identify as a healer of some sort, a psychedelic therapist, a practitioner, a psychiatrist, underground practitioner, guide, sitter, whatever term you want to use, I think it's very easy to over identify with that. It's called ego identification. I don't want to use too much jargon, but another one is ego inflation, where we think, oh, we are the healer, we are the expert, we can facilitate this, we can help this client. And one thing that means is that our inner woundedness, our inner client, our inner part of ourselves that is in need of healing is in the shadow. And if we can't see it, we can't work on it. And more than that, we actually unconsciously project it onto our client. So this two-way thing happens. We project our shadow side, our part that needs healing, onto our client. Um, and we can see that, if we want to be the best provider, the best therapist for the client, it's really what we're projecting on the client is our own, quote, irredeemable part, as Edward Whitman calls it in The Alchemy of Healing. And of course, the client projects their inner healer on us or on the therapist. And so this double unconscious projection really keeps both parties trapped. And this is this is not harmless. There's a haunting quote by Jung, and I swear I saw it. I've looked for it for years again, and I've had trouble finding it again, I admit, but I know I read it. If the wounded healer doesn't address their own wounds, they become the wounded wounder. And again, that's in a way what Edward Whitman is saying in his book, The Alchemy of Healing, is that when we don't see that we're asking the client to carry our own woundedness, our own, quote, irredeemable part, we keep them trapped. Now, another aspect of this is, another, in a way you could say it's a shadow aspect because it's something that's become sort of mandatory and required. It's like a prerequisite. It's something called psychedelic enthusiasm. There's been this hunger for new approaches, and in this hunger, there's sort of this everybody's really enthusiastic, which on the one hand is natural, but on the other hand, I think that really silences or creates the implicit message, oh, well, we can't really criticize or question or look at the shadow side of this burgeoning industry, really, because we all have to be really positive and enthusiastic, and we mustn't do anything that might threaten this psychedelic renaissance. And I think that, again, creates an unconscious power structure that makes certain very important topics, puts them into the collective shadow, the community shadow, the cultural shadow. And I think that one reason there's this psychedelic enthusiasm right now, because a lot of people, both clients and practitioners of various sorts, are really hungry for new approaches. There's a deep sense that behavioral health, mental health, whatever you want to call it, psychopharmacology, and the various three-letter acronyms of various modalities have really not helped a number of people. If you look at Robert Whitaker's work, The Anatomy of an Epidemic and Mad in America, the number of psychiatric diagnoses and the number of people on disability for psychiatric or mental health diagnoses is steadily climbing. At the same time, the number of prescriptions, psychiatric prescriptions, is steadily climbing. So we're not, when antibiotics for tuberculosis were first introduced, the number of prescriptions climbed and the incidence of tuberculosis plummeted. So if the current approaches were helping the community, the population at large, the number of diagnoses and the number of people on disability should go down, and that's not happening. It's this exploding problem, of course, COVID and other more smoldering issues of contemporary life, the alienation of capitalism, ecological grief, are all contributing to this explosion in, quote, mental health diagnoses and human suffering. And so it's very natural to say, well, there's got to be something else we can do. Oh, here's all this research now on psychedelics. Let's get trained. Let's promote this. The psychedelic enthusiasm is understandable. There is a huge need. Providers and clients know that what we've been offering so far hasn't really provided significant help. Now, the interesting thing I would say is that the same enthusiasm happened when Prozac, as sort of the safer, quote, at the time, new antidepressants were launched. There was the same sort of enthusiasm. There were books, there was real culture shift, books like Listening to Prozac or Prozac Nation or Andrew Solomon's Noonday Demon. This awareness, or when these new forms of treatment enter the culture society, it's not something neutral, it really changes the culture. And that's what we're seeing. But the problem is, in this psychedelic enthusiasm, in this hunger for new approaches, in the explosion of treatment providers, people getting trained, I worry that we're actually replicating unconsciously how we deliver care and the power structures inherent in the system, because we're unconscious of our own inner wounds, of our own woundedness that has both co-created the system and are also our unconscious wounds perpetuate the system. Because we're not aware of them. The system has an inherent hierarchy. Here's the practitioner, here's the expert, here's the research, the academic centers, and here's the client. And these people, what they say goes, and the clients have to be passive recipients. And the sad thing is that's really been replicated in psychedelic therapy. There are now, research centers, academic research centers that are doing studies, and those studies are creating a market really. And there are clients that, some clients, of course, are seeking other resources, but many clients are saying, well, now I'll wait till it's legal. And not only are there academic research centers, there's also companies, pharmaceutical companies that are patenting approaches. And this is not a given. It's the way it is, but we have to question this because these discourses have an inherent power structure, and these power structures actually create a silencing. There's a disempowering effect to the client. The word patient, I don't like the word patient because the word is, oh, you got to be patient, you got to wait, you got to accept. Even the word client, again, implies that you're a customer or a client of some service, which isn't ideal because you're still a recipient of something. But these power structures also silence the long tradition of indigenous use of psychedelic therapies, of plant spirit medicines, plant spirit teachers. They silence other approaches. And again, they silence this opportunity. And it's not just the academic research centers and the burgeoning new psychedelic pharmaceutical companies. It's really an unquestioning attitude, an unreflective attitude amongst all providers. Yes, people want to get into it, they're getting trained, but the overall, how are we doing this and why are we doing this and what part of ourselves are we unconsciously ignoring and what power structures are we unconsciously recreating in this new renaissance, that I feel no one's really talking about. And one thing that happens with this hierarchy is as I said earlier, it really creates an opportunity or sort of the environment for power tripping. And one way we see that is, when I first started working with ketamine 12 years ago in 2011, I would give people a few treatments. There was no guidelines. And I'm not saying I'm better than anybody else, but what's happening now is, okay, giving a repeat number of treatments has become the standard of care. And then now maintenance treatment is really burgeoning. More and more people are saying, oh, I got to come in every few weeks or whatever and keep. So instead of this transformative potential of this truth serum, of this mirror saying, okay, what do I need to change in my life? What message from my unconscious do I really need to take to heart and change my life? No, I'll just go back and get more treatments. And of course, I'm not, what I said sounds very much like it's from the client's point of view, but the client and the practitioner are all playing into this. Of course, if the client's coming in wants to come in every few weeks, it's hard to say no because, we're used to having clients long term and we're used to the income and it's very tempting, but we're not really saying what's unconsciously perpetuating the system. Another aspect of the psychedelic enthusiasm that I mentioned is that it really makes it difficult to ask difficult questions. There's this sort of mantra like, oh, we can't do anything to undermine the cause. And we can't say, well, what are we doing? Is there a better way to do this? Is there a way that's really more empowering? And so again, it keeps our clients trapped and it keeps ourselves trapped in the expert role, in the ego inflation with identifying with the provider, the practitioner, the therapist, whatever you want to call it. Now, I've mentioned this term throughout. I've mentioned the term shadow, and I really want to talk a little bit. So there's individual shadow, the part of ourselves we can't see. And of course, there's a community shadow. In a way, the psychedelic enthusiasm implies there's all these things we shouldn't talk about, we can't talk about. And the real cultural shadow saying, is there really an opportunity to radically change how behavioral health is delivered? Should we even use that term? How can we make people more resilient? How can we stop turning people into professional patients? And so it's really important to think more about what the shadow actually is. There's a quote, I remember hearing it in that movie, The Usual Suspects, but it's much older than that. The greatest trick the devil ever played is convincing us he doesn't exist. And Jung said it in a different way. He said, until you make the unconscious, the shadow, conscious, it will direct your life and you will call it fate. Fate is a good word. It's sort of this external, in the old days people would say, oh, the devil made me do it, or I was born under an unlucky star. And when Jung writes more about this pattern, he uses the German word Gestirnszwang, the compulsion of the stars. He uses the Greek word Heim Armene, which is really awkward. So the word fate is nice because it's this idea that there's these forces outside our conscious control. And that's, again, the greatest trick is to say, well, these forces are beyond my control. It's not so much about whether we're good or bad. It's really about how conscious or unconscious we are and whether we're willing to really commit to making the unconscious conscious. And again, that's really the wounded healer's journey. The wounded healer's journey is saying, what is it in me? What are my unconscious parts? What is my shadow? What are my wounds that are pushing me, have shaped me, direct me in how I journey, witness, sit with the clients, and what part of myself am I asking the client to carry? So these are just some initial thoughts, which is why, these are some initial thoughts that I wanted to mention. It's really just the beginning of a discussion. There are many topics, there are many other shadow sites to discuss, but I want to invite you, if you feel triggered or interested in any of what I've said, we're doing a weekend intensive class on February 4th and 5th called The Wounded Healer in Psychedelic Therapy, where we'll really go into these topics a lot more, but it's not just going to be a presentation for 2 days. It's really giving you tools, techniques, a framework, an attitude, and a commitment, inspire you to commit to this wounded healer's journey. So hopefully we'll see some of you in that class. Thank you.